Abstract. Background: the assessment of pain is critical for the welfare of horses, in particular when pain is induced by common management procedures such as castration. Existing pain assessment methods have several limitations, which reduce the applicability in everyday life. Assessment of facial expression changes, as a novel means of pain scoring, may offer numerous advantages and overcome some of these limitations. The objective of this study was to develop and validate a standardized pain scale based on facial expressions in horses' Horse Grimace Scale. Methodology/principal findings: 40 stallions were assigned to one of two treatments and all animals underwent routine surgical castration under general anesthesia. Group N equals 19 received a single injection of flunixin immediately before anesthesia. Group B N equals 21 received flunixin immediately before anesthesia and then again, as an oral administration, 6 hours after the surgery. In addition, 6 horses were used as anesthesia controls. C. These animals underwent non-invasive, indolent procedures, received the same treatment as Group A, but did not undergo surgical procedures that could be accompanied with surgical pain. Changes in behavior, composite pain scale scores, and Horse Grimace Scale scores were assessed before and 8 hours post-procedure. Only horses undergoing castration groups A and B showed significantly greater Horse Grimace Scale and composite pain scale scores at 8 hours post compared to pre-operatively. Further, maintenance behaviors such as explorative behavior and alertness were also reduced. No difference was observed between the two analgesic treatment groups. Conclusions: the Horse Grimace Scale potentially offers an effective and reliable method of assessing pain following routine castration in horses. However, auxiliary studies are required to evaluate different painful conditions and analgesic schedules. Funding: the authors would like to thank the 7th Framework Programme of the European Community for Research for financing the Animal Welfare Indicators project. The funders had no role in study design, data collection and analysis, decision to publish, or preparation of the manuscript. Introduction: the recognition and alleviation of pain is critical for the welfare of horses. Although considerable progress has been made in understanding physiology and treatment of pain in animals over the past 20 years, the assessment of pain in horses undergoing management procedures, such as branding, pin firing and castration, remains difficult and frequently suboptimal. Equine castration is a husbandry practice routinely performed to avoid undesired mating, facilitate handling, and reduce aggression and other undesirable behaviors. Annually, it is estimated that 240,000 horses are castrated in Europe. Studies in other species demonstrate that animals experience pain and discomfort both acutely and chronically following castration. Despite the limited research in horses, castration has been shown to be associated with some degree of pain that can persist for several days and, therefore, requires adequate analgesic treatment. Price reported that only 36.9% of horses received analgesics for post-operative pain, with one perioperative administration of flunixin appearing to be one of the most common analgesic procedure provided following castration. One possible explanation for this is the difficulty in assessing and quantifying pain in this species. For example, even though castration of horses is a common procedure, no gold standard for pain assessment is available to date. As in other animal species, pain in horses is difficult to assess because of their inability to communicate with humans in a meaningful manner. This could be further compounded by horses potentially suppressing the exhibition of obvious signs of pain in the presence of possible predators, i.e., humans, as is suggested with other prey species. Several behavior-based assessments of pain in horses already exist. The post-abdominal surgery pain assessment scale is a multidimensional scale that can be used to quantify pain after laparotomy. The composite pain scale focuses on the presence of pain-related behaviors and the change in the frequency of normal behavior patterns and physiological parameters, and has been successfully applied following both surgery e.g. castration, injury and disease e.g. laminitis, colic. However, behavior-based assessments of pain are not without limitations that constrain their routine application. These include the need for trained and experienced observers. Furthermore, Many of the pain-related behaviors described so far have been identified in response to what are perceived to be severely painful conditions e.g., colic, laminitis. Facial expressions are commonly used to assess pain and other emotional states in humans, particularly in those who are unable to communicate coherently with their clinicians e.g., those with cognitive impairment and neonates. In humans, facial expressions are routinely scored both manually and automatically using the facial action coding system, which is considered as an accurate and reliable method that describes the changes to the surface appearance of the face resulting from individual or combinations of muscle actions, referred to as action units. Action units relating to pain have been identified in rodents and rabbits and incorporated into species-specific grimace scales. These grimace scales are considered to give a number of advantages over other routinely used methods of assessing pain in animals. Firstly, grimace scales are less time-consuming to carry out. Secondly, observers can easily and rapidly be trained to use them. Thirdly, grimace scales may utilize our potential tendency to focus on the face when scoring pain. Fourthly, they can be used to effectively assess a range of painful conditions, from mild to severe pain. Finally, it can increase the safety of the observer when assessing pain in large animals, as grimace scales do not require the observer to approach the subject and palpate the painful area for the assessment. Therefore, the Horse Grimace Scale may offer an effective and practical method of identifying painful conditions and the efficacy of the methods we use to ameliorate pain in horses i.e., analgesia administration. Furthermore, it can be applied in association with other behavior-based methods to enhance the assessment of pain in horses and could be implemented in practice by owners and stable managers as an effective on-farm early warning system. The objectives of this study were to develop and validate a standardized pain scale based on facial expressions in horses' Horse Grimace Scale using routine castration, and to investigate whether the Horse Grimace Scale could be successfully implemented with minimal training, enabling the development of an on-farm pain assessment tool. Castration was considered a suitable model for the development of Horse Grimace Scale because it is amongst the most common management procedures carried out in veterinary practice. In addition, utilizing animals that are undergoing routine castration for husbandry reasons allows the researchers to avoid carrying out a surgical procedure solely for the evaluation of a method of assessing post-procedural pain. Materials and methods. Ethics statement. Castration is a routinely conducted husbandry procedure that was carried out in compliance with the European Communities Council Directive of 24 November 1986. This study was registered as an animal experiment at the Brandenburg State Veterinary Authority. Horses involved in this study underwent routine veterinary procedures for health or husbandry purposes at the request of their owner on a voluntary basis. Consequently, no animals underwent anesthesia or surgery or were directly used in order to record data for the purposes of this study. Verbal informed consent was gained from each participant prior to taking part in this research. Written consent was deemed unnecessary as no personal details of the participants were recorded. No animals received less than the standard analgesic regimen for the purposes of the study. The study employed a strict rescue or analgesia policy if any animal was deemed to be in greater than mild pain assessed live by an independent veterinarian. Then additional, pain-relieving medication would immediately be administered and the animal removed from the study. The choice of medication and dosage would be based on the severity of pain identified through the clinical examination of the individual horse. Animals and husbandry. 40 stallions of different breeds, coat colour and aged between 1 and 5 years mean age 2. 3 years underwent routine castration. In addition, 6 horses of mixed age and gender that were undergoing general anaesthesia for different non-invasive and indolent procedures were used as a control group. All animals were recruited from the hospital's clinical cases. In order to be included in this study, all the subjects had to be deemed healthy and without signs of cryptorchidism by an equine veterinarian after physical examination and behavioural evaluation. All horses were hospitalised in a veterinary clinic for 5 days to undergo castration or anaesthesia alone, in order to control for any possible effect of stress related to being in a novel environment and separated from their peers. All the subjects were allowed to acclimatise to their new environment. Clinicians and video cameras for 2 days prior to the beginning of the study, in order to control for any possible differences in behaviour between stallions, geldings and mares The acclimation period before starting with data collection was the same for all the horses. All subjects were kept in the same housing and management conditions. They were housed in standard single-horse boxes 463 with an outside window on wood shavings. German horse span classic, German horse pellets, Wismar, Germany, and in visual contact with other conspecifics. They were fed twice a day with hay, approximately 3 kg/100 kg body weight per day, and water was provided ad libitum by automatic drinkers. Food was withheld from all horses for 8 hours before and 5 hours after anesthesia, standard protocol for general anesthesia, in order to collect videos and images without disturbing the behavior of the horses. 2 digital video cameras were positioned on the top of the grate section on the opposite sides of the box. Surgery and analgesic treatment groups. Horses undergoing castration were divided into 2 breed-matched treatment groups using the blocked randomization process. Group N equals 19 received a single perioperative injection of flunixin 1 mg/kg. Flunixin 5%. Medistar, Ashburg, Germany, approximately 5 minutes prior to anesthesia immediately after administration of sedative drug. Group B N equals 21 receive a perioperative injection of flunixin 1 mg/kg. As the grouper and a subsequent oral application of flunixin flunidol 5%, CP Pharma, Bergdorf, Germany, 1 mg/kgp, or 6 hours after castration. All the medications were administered by veterinary nurse who was aware of group allocation. The veterinarians responsible for pain assessment were blinded to treatment group. Horses underwent routine surgery, castration with closed technique through a scrotal approach without primary closure of the wound in dorsal recumbency under general anesthesia, as recommended by the National Equine Welfare Council and the Canadian Veterinary Medical Association. The surgeries were all carried out by one of 2 equally experienced veterinary surgeons. To investigate the impact of general anesthesia on the Horse Grimace Scale, a control group C of horses was recruited. The control horses N equals 6 underwent the same general anesthesia protocol as horses in groups O and B and received a single perioperative injection of flunixin 1 mg/kg. 5 minutes prior to anesthesia. All castrated horses also received antibiotic treatment for 3 days starting at the morning before surgery. Sinutrum 72% pulver, Retaquinol, Ravensburg, Germany, 24 ng trinithoprene and 12 ng sulfadazine/kgp, OS every 12h. Prior to the first drug application, the weight of each horse was estimated with a weight tape in order for the correct drug doses to be administered. The anesthesia protocol was the same for all the subjects pre-medication with romifidine sedivit, Boehringer Ingelheim Vetmedica, Ingelheim, Germany, 80 micrograms romifidine hydrochloride/kg, induction with diazepam ratiopharm, Ulm, Germany, 0, 1 ng/kg and ketamine 10%, Medistar, Ashburg, Germany, 2 mg/kg intravenously via a jugular catheter. When necessary, general anesthesia was maintained by another injection of ketamine 1 ng/kg. 26 out of 40 castrated horses, 65%, and 2 out of 6 control horses, 3% needed a second injection of ketamine to maintain an appropriate level of anesthesia in order to complete the surgery or the non-invasive procedure. The duration of anesthesia was comparable long all the subjects. Surgery lasted 10-15 min, following which horses were moved to a recovery box. Then, as soon as they were able to walk 20-60 minutes after anesthesia, returned to their home box. Recovery from anesthesia is the time that a horse needs to stand up. It strongly depends on individual differences and it does not necessarily reflect the duration of previous anesthesia. Horses recovered from anesthesia without assistance inside the recovery box under visual supervision of a veterinary nurse. No intraoperative complications were reported and all horses recovered from anesthesia fully and uneventfully prior to the first data collection post-procedure. All surgeries/general anesthesia were carried out between 9 and 11 a.m. Pain assessment. At each time interval an overall pain assessment was conducted by 2 trained veterinarians blinded to treatment group using a composite pain scale based on the one developed by Bessières and colleagues and adapted according to Sondergaard and Haleco. Video recording. 30-minute video sequences were recorded using two high-definition cameras with a 28mm wide-angle objective lens. The videos were recorded one day before procedure in the evening baseline observation, pre-procedure, and at similar time 8 hours following procedure 8H post-procedure. The cameras were positioned at opposite sides of the box on the top of the great section. This arrangement gave the highest probability of capturing the behavior and face of the horse during filming without interfering with their normal behavior. Behavioral recording. Behavior of horses undergoing castration was evaluated. For each video, the last 15 minutes were analyzed. A focal animal continuous recording method was used to describe the horse's activity. The frequency and duration of 30 categories of behavior was continuously recorded using Solomon Coda by 2 trained treatment and session blind observers. Behaviors recorded as states movement, licking and chewing, alertness, agitation, investigative behavior, drinking, eating, load head carriage, head orientation, grooming were reported as durations, and those recorded as events weight shifting, pawing, kicking, flank watching, rolling, yawning, masturbating, vocalization, urinating, defecating, tail swishing, flamen were reported as frequency of occurrence. Duration of maintenance behaviors showing the same pattern were added to form the composite maintenance behavior score, comprising exploration, alertness and grooming. Horse Grimace Scale. Recording the Horse Grimace Scale was created following the methods developed by Langford and Suttersinel for rodents and Keating for rabbits. Changes in horse behavior and facial expressions were identified using a pilot study following 8 stallions undergoing surgical castration with the same anesthetic and analgesic protocol as used in the main study, according to the published literature. Still images were extracted from each video sequences whenever the horse was found in a position with the head and face clearly visible. This enabled a number of clear and high-quality images to be extracted. Each image was then cropped so that only the head of the horse was visible to prevent observers from being biased by the body of the animal when looking at each image. Images of each subject before and 8 hours after surgery were compared to identify changes in facial expressions associated with these procedures by a trained treatment, blind observer experience in assessing facial expressions in other species. Based on these comparisons, the Horse Grimace Scale was developed and comprises 6 facial action units: stiffly backwards ears, orbital tightening, tension above the eye area, prominent strained chewing muscles, mouth strained and pronounced chin, strained nostrils and flattening of the profile. 126 images were randomly selected by a non-participating assistant with no experience of assessing pain in horses for further scoring. 3 pre and 3 post-procedure images. In order to maintain a balanced design for the statistical analysis, the image set comprised 1 or 2 pictures of each horse pre and 8 hours post-procedure, e.g. lateral images pre and post and frontal images pre and post. The 126 images were then scored in a random order using the Horse Grimace Scale by 5 treatment and session pre or post-surgery blind observers. A detailed handout with a description of the 6 identified facial action units, and the scoring system was distributed to the observers. Briefly, for each image each observer was asked to give a score for each facial action unit using a 3-point scale: 0 equals not present, 1 equals moderately present, 2 equals obviously present. If the participant was unable to score a particular facial action unit clearly, they were asked to score it as I don't know. The Horse Grimace Scale score was determined by adding the individual scores for each of the 6 action units identified: stiffly backwards ears, orbital tightening, tension above the eye area, prominent strained chewing muscles, mouth strained and pronounced chin, and strained nostrils and flattening of the profile in each image. Consequently, the maximum possible Horse Grimace Scale score was 12 i.e. a score of 2 for each of the 6 facial action units. In addition, the observers were asked to make a global pain judgment for each picture: no pain versus pain based upon their own clinical experience. If they deemed the individual to be in pain, then they were asked to score the intensity of that pain: mild, moderate or severe, in order to explore the effect of time, pre versus post-procedure and treatment, analgesia and surgery. The mean Horse Grimace Scale scores were calculated for each image across all participants. Observer selection. 5 observers were selected as they had expertise either with horses or scoring facial expressions. The observers had diverse backgrounds, including horse welfare researchers, veterinary surgeons, research scientists and veterinary students. Statistical analysis. All statistical analyses were conducted using SPSS 19. Differences were considered to be statistically significant if pH 0.05. The data were tested for normality and homogeneity of variance using Kolmogorov-Smirnov and Levine test, respectively. Composite pain scale and Horse Grimace Scale scores were not normally distributed, and therefore the scores were transformed using square root transformation. Repeated measures general linear model was used to analyze the data with the time points pre and 8 hours post-procedure as the within subjects factor and the treatment group as the between subjects factor. Any treatment effects were further investigated using analysis of variance with data from the separate time periods forming the dependent variables and treatment as the fixed effect. Post hoc analysis of treatment group effects was conducted using Bob-Ferroni post hoc test. The reliability of Horse Grimace Scale was determined using interclass correlation coefficient to compare mean scores for each of the facial action units across all the participants. Accuracy was determined by comparing the global pain and no pain judgment made by the treatment and period blind observers with actual pain state of the horse in each photograph. The reliability of the composite pain scale scores were analyzed using an interclass correlation coefficient. Reliability of the manual behavior analysis was assessed by means of independent parallel coding of a random sample of videotaped sessions, 5 clips, using percentage agreement. Wilcoxon test was conducted to determine differences in behavior shown before and 8 hours after procedure. Spearman correlation coefficients were calculated to investigate the relationship between the composite pain scale, Horse Grimace scale and behavior. Results. During the study, no horses required the administration of rescue analgesia or had to be removed from the study due to adverse events. Horse Grimace scale, time, treatment and time * treatment interaction had significant effects on Horse Grimace scale score repeated measures general linear model, p equals 0, 0, 0, 0, p equals 0, 0, 0, 7 and p equals 0, 0, 0, 0, respectively, G2 equals 0, 0, 3. In the pre-procedure period, there was no significant difference between the 3 treatments analysis of variance, p equals 0, 84, G2 equals 0, 0, 0. At 8 hours post-procedure, the Horse Grimace scale score was significantly different between the 3 treatments analysis of variance, p equals 0, 0, 0, 0. G2 equals 0, 11, with the Horse Grimace scale score being significantly higher in horses undergoing routine castration groups A and B compared to the control group C Bob-Ferroni post hoc, p equals 0, 0, 0, 0 for both comparisons. No significant differences were found between groups with a single or multiple biflunixin administration Bob-Ferroni post hoc, p equals 1, 0, 0, 0. Example images and associated Horse Grimace scale scores of horses in groups undergoing castration compared to control are shown in Figure 4. Total observation time was approximately 40 minutes for scoring all the pictures. The average accuracy of global pain judgment was 73.3%, with false positives being slightly more prevalent 17.0% than misses false negatives 9.8%. Individual accuracy of participants varied from 67.5% to 77.8%. The Horse Grimace scale demonstrated high inter-observer reliability with an overall intraclass correlation coefficient value of 0.92. The individual action units comprising the Horse Grimace scale also showed high interclass correlation coefficients values of 0.97 for stiffly backwards ears, 0.83 for orbital titling, 0.86 for tension above the eye area, 0.88 for prominent strained chewing muscles, and 0.72 for mouth strained and pronounced chin. The only exception was for strained nostrils and flattening of the profile interclass correlation coefficients equals 0.58. On average, all the 6 facial action units were assessed easily by all the participants, As shown, by the percentage of not able to score ranging from 0% for ear position to 21% for the tension above eye and strained mouth and pronounced chin. Front view images were more difficult to score than profile view images, in particular for the evaluation of prominent strained chewing muscles and mouth strained and pronounced chin. 46% and 81% respectively of not able to score. In profile view images, horses with dark brown or black coats were more difficult to score than grey and light brown coat, especially for the orbital tightening and prominent strained chewing muscles. 12% and 16% respectively. Composite pain scale, time, treatment and time * treatment interaction had significant effects on composite pain scale score. Repeated measures general linear model p equals 0, 002, p equals 0, 002 and p equals 0, 050, respectively. G2 equals 0, 28. In the pre-procedure period, there was no significant difference between the treatments. Analysis of variance, p equals 0, 65, G2 equals 0, 02. At 8 hours post-procedure, the composite pain scale score was significantly different between the three treatments. Analysis of variance, p equals 0, 000, G2 equals 0, 41, with the composite pain scale score being significantly higher in horses undergoing routine castration. Groups A and B compared to the control group. Group C Bonferroni post-hoc, p equals 0, 000 for both comparisons. No significant differences were found between groups with a single or multiple B-flunixin administration. Bonferroni post-hoc, p equals 1, 000. The composite pain scale demonstrated good inter-observer reliability between the two analgesic treatment blind observers, with an overall interclass correlation coefficients of 0.79. Behavior analysis, percentage agreement between the two observers was more than 80% for all the behaviors. Many of the pain-related behaviors were observed too infrequently to be meaningfully analyzed. Low head carriage showed a tendency to increase in duration at 8 hours after castration. Wilcoxon, p equals 0, 0.68 compared to baseline. Duration of exploration and alertness significantly decreased at 8 hours post-castration. Wilcoxon, p equals 0, 000 and p equals 0, 008, respectively compared to baseline. The composite maintenance behavior score comprising the sum of the duration of exploration, alertness and grooming significantly decreased at 8 hours post-surgery. 148, 1,621, 7 sec compared to pre-363, 5,636, 4 sec. Wilcoxon, p equals 0, 000. There was no significant effect of treatment or B on either maintenance or pain-related behaviors. Total observation time needed to analyze all the videos was approximately 20 hours. Relationship between behavior, composite pain scale and Horse Grimace Scale. The Horse Grimace Scale score was correlated positively with the composite pain scale score. Spearman correlation R equals 0, 580 p equals 0, 000 and negatively with duration of explorative behavior. Spearman correlation R equals 20, 461, p equals 0, 002. The Horse Grimace Scale score was negatively correlated with the composite maintenance behavior score. Spearman correlation R equals 0, 508, p equals 0, 001. Discussion. Despite the severity of pain associated with routine castration in horses being contentious, have demonstrated that this procedure is associated with some degree of pain. An untreated control group undergoing castration without any analgesic treatment was not included in this study for both ethical and welfare reasons, as pain can cause a long-lasting welfare issue in horses. Although better balanced control group would be preferable, the control group used in this study to evaluate the effect of general anesthesia on Horse Grimace Scale was similar in size, age, sex, and clinical conditions to control groups presented in other scientific studies on the assessment of pain in horses. As general anesthesia for horses is not without risks for health and welfare, recruit more horses or healthy stallions to have a more homogeneous control group would be questionable for both ethical and welfare reasons. This study has identified changes in facial expressions in horses undergoing surgical castration that appeared to be similar to those previously described in other species. In this study, differences in Horse Grimace Scale scores were observed following a routine surgical castration, with an increase in scores from pre to 8 hours post-procedure. Importantly, no differences in Horse Grimace Scale scores were found in control horses undergoing general anesthesia for non-invasive procedures, demonstrating that general anesthesia has no effect on the Horse Grimace Scale. Pain-related behaviors and physiological parameters assessed using the composite pain scale. It has been clearly demonstrated previously that pain in horses can be expressed through the exhibition of general non-specific indicators such as decrease in normal activity, lowered head carriage, fixed stare, rigid stance and reluctance to move. In a preliminary study on castration pain in horses, Eager and colleagues also found that grooming decreased 6 hours post-operatively. In the present study, horses undergoing routine castration showed the tendency to keep their head in a lower position 8 hours post-surgery. Although non-specific behavioral indicators of pain in equids are considered not to correlate strictly with severity of pain, the tendency to carry the head below the withers is of relevance because several authors reported that lower head carriage is shown in case of chronic or severe pain. The results of this study demonstrate that the Horse Grimace Scale is a potentially effective method of assessing castration-related pain in horses. Horse Grimace Scale scores significantly increased from pre to post-castration and were unaffected by anesthesia alone, indicating that the action units relate directly to post-procedure pain and slash or distress. As there was no difference in the Horse Grimace Scale between the two analgesic treatment groups, we are unable to fully differentiate between post-procedure pain and distress in this study. However, the significant difference between control and treatment groups and correlation between Horse Grimace Scale, composite pain scale and some non-specific behavioral indicators of pain suggest that the action units comprising the Horse Grimace Scale are likely to change in response to pain. There are two potential explanations for lack of difference in Horse Grimace Scale scores between those horses receiving a single preoperative administration group A and those receiving a pre- and post-operative administrations group B of flunixin. It is possible that both the Horse Grimace Scale and composite pain scale were insufficiently sensitive to discriminate between effects of the analgesic schedules used. Alternatively, the two administrations of 1 mg/kg of flunixin 6 hours apart i.e. pre- and post-operatively may not provide greater pain relief than a single preoperative administration. Duration of pain relief for flunixin is contradictory. Johnson found that additional flunixin was needed 12,864 3H after surgery. For this reason, we decided to give a second dose of flunixin before the 8-hour measurement. 12843 equals 85H minus time for oral absorption of flunixin. As we did not include untreated control group undergoing castration without any analgesic treatment in the study for ethical and welfare reasons, we are unable to provide insight into which explanation is correct. Therefore, further studies investigating the Horse Grimace Scale, composite pain scale and behavioral indicators of pain as well as the efficacy of 1 mg/kg of flunixin and other analgesics with routine castration are needed to answer the above question. The overall accuracy of the Horse Grimace Scale 73% was slightly lower than that of the other Grimace scales. 97% for the Mouse Grimace Scale, 82% for the Rat Grimace Scale, and 84% for the Rabbit Grimace Scale. The most likely explanation for this is a combination of a slightly lower quality for some of the images used compared to those scored in other Grimace scales and considerable variation in coat colour of the horses observed. Coat colour of the horse combined with the quality of some of the images meant that dark horses were often more difficult to score than those with lighter coats, especially if the background was dark. This issue has already been observed in mice, where the higher the quality of the images and a contrasting background allowed the observers to more accurately score the images. 4 out of 6 control horses had a light coat which allowed easier scoring, meaning that the finding that the control horses did not present any differences in Horse Grimace Scale before and after anesthesia is highly reliable. The inter-observer reliability, as measured by interclass correlation coefficients of the overall Horse Grimace Scale and its component action units, was similar to those of the Mouse Grimace Scale 0, 90, Rat Grimace Scale 0, 90 and Rabbit Grimace Scale 0, 91. As with other Grimace scales applied to animals e.g. rodents and rabbits, The observers in this study gave images of the horses in a non-painful state e.g. pre-procedure low but not zero scores, which is inevitable when using a scale that is a composite of 6 individual action units. In a non-painful state, these action units can be observed occasionally in isolation at a low intensity, score of 1 rather than 2. For example, if an image is taken of a horse as it blinks, then an observer may give orbital tightening a score of 1 or 2, but it is likely that they will score 0 for all the other action units. It is unlikely that Horse Grimace Scale scores lower than 2 are due to stress related to being in a novel environment, as all the horses were acclimated to the new environment. Using the Horse Grimace Scale to score horses live rather than from images will help to solve this issue. The use of Horse Grimace Scale for scoring post-operative pain has distinct advantages over that of manual behavior analysis, which can be complex due to the greater number of behaviors and potentially need to be scored. Behavior-based assessments appear to be more time-consuming to conduct. Analysis time was 20 hours for behavioral-based assessment compared to 40 minutes for the Horse Grimace Scale. Furthermore, changes in facial expressions in the horses were detectable without the need of approaching the subject, and by observers with differing expertise with only the Horse Grimace Scale manual for guidance. The Horse Grimace Scale requires some further validation for assessing post-castration pain, for instance in horse with administration of flunixin compared to horses with flunixin associated with an opioid post-surgery, considering longer follow-up intervals, and could be further developed for other potentially painful procedures before it can be considered fully validated. Further studies could also be conducted to identify facial action units associated with other states such as fear and anxiety so that we are able to differentiate pain from these other states. Among the limitations of other routinely used methods of assessing pain in horses, there is considerable concern that prey species have evolved the ability to mask obvious signs of pain under specific circumstances, i.e., the presence of a predator such as humans. In humans, it has been demonstrated pain-related facial expressions cannot be completely suppressed by voluntary control, and in another prey species, for example the rabbit, it has been demonstrated that facial expressions are an easy and reliable cage-side method of assessing acute pain associated with ear tattooing in the presence of an observer. It has been shown that humans tend to focus on head and face when assessing pain in humans, and rabbits. Therefore, this method could represent a reliable and feasible method that utilizes the natural human instinct. Furthermore, Horse Grimace Scale could be used as an animal-based indicator of spontaneously emitted pain, and it may provide insights into the experience of pain in horses in their own environment, and so be a useful tool in the assessment of horse welfare on farm. Even though further evaluation of the Horse Grimace Scale is required, the present result suggests that Horse Grimace Scale may offer a reliable tool for assessing post-castration pain than other routinely used methods.